So on the afternoon of June 3rd, 2022, Medic 715, Rescue Squad 715 were dispatched to the Jiffy Loop for the report of one having a stroke. When the crew arrived to the scene, they were led to the back room where they found a seriously ill patient. Coworkers of the patient stated that the patient came to work on time, but shortly after his arrival, he began to feel lightheaded and complain of heart palpitations. The coworkers had the patient sit down and tried to get him to drink some water, but the patient suddenly stopped responding to his coworkers, so they called 911 for assistance. Crews from Medic 15, Squad 15 noted the patient presented with diaphoresis, left-sided weakness, tachycardia, and a decreased level of consciousness. The crews worked quickly to assess the patient's vitals and place him on the cardiac monitor, found to be in a supraventricular rhythm with a rate of 180 beats per minute. Firefighter paramedic Jan recognized the patient's condition was critical, so crews worked together to quickly package the patient to move him to a better location to treat his priority symptoms and called for a second medic to the scene to assist with the time-sensitive treatments for the patient. Paramedic Engine 715 arrived on scene to assist. Together, the crews were able to establish an IV and prepare to administer adenosine to treat the SVT. Paramedics Jan and Lally were able to administer 3 doses of adenosine, but after each dose, the patient converted back to a supraventricular rhythm. The decision was made to transport to White Oak Medical Center as a priority 1 patient. En route to the hospital, the patient experienced a complete loss of consciousness. Due to the patient's unstable condition, the decision was made to synchronize cardiovert the patient. After administering the shock, the patient regained consciousness and his cardiac rhythm converted to sinus tach around 102 beats per minute. The patient was able to sit up on his own and he was alert and oriented. The patient was able to answer questions and follow commands appropriately, although he was still demonstrating some left-sided weakness and slurred speech. Medical consult was performed via EMRC with White Oak, updating the awaiting staff of the patient's condition. Upon arrival to White Oak, the patient care was transferred to the emergency department staff. The emergency room staff stabilized the patient and sent him to have a CT due to his continued left-sided weakness and slurred speech. Thanks to the skills, knowledge, and teamwork of Montgomery County Fire and Rescue Service responders, the staff of White Oak Medical White Oak Center, the patient was transferred to a rehabilitation care facility and continued strength to the left side and was eventually able to return home on July 7th, 2022.